the constitutionality of the federal health care law. As most of you know, on March 23rd, 2010, President Barack Obama signed into law the Patient Protection and Affordable Care Act. The law's centerpiece provision is the controversial individual insurance mandate, which forces individuals to purchase health care insurance or pay a penalty. The lawsuits challenging the federal health care law are largely focused on this provision.
One interesting thing I saw was a member of the Texas legislature has introduced a bill making it a felony, punishable by 5 years in jail and a $5,000 fine if anyone dares to implement the law there. So I don't want to give my colleagues any ideas, but that gives you a sense of the tone of the debate in the country right now about this law. A lot of people really don't like it. A lot of Republicans really hate it. Fair enough.
Major court rules.
I think panels like these are always very helpful to bring up issues of the day and to explain what's going on and to provide competing points of view. That's always very helpful in any situation, but especially something as momentous as the health care law we're dealing with. It's a great thing to talk about, and I'm always happy to talk about how the health care law is allowed under the Commerce Clause and the General Welfare Clause, the Necessary Proper Clause of the United States Constitution.
A teeter-totter only works if somebody's sitting on each end of the teeter-totter. And if we do not have somebody fighting for the rights of each side in the balance of power, then the balance no longer exists. I think if you listen to or you read from legal scholars across the nation, regardless of their political philosophy or their judicial philosophy, regardless of their position on whether this health care law is good for the people or bad public policy, regardless of those positions, I think you will find the overwhelming majority of legal scholars do agree on this one thing, and that is that there is a legal issue here to be decided and debated.
I've been involved in several, one recently at the National Congress on Health Reform. I've also given talks about this issue at a number of law schools and other institutions.
Well, as Representative Richard suggested, the main argument they rely on is actually under the Commerce Clause. What does the Commerce Clause actually say? It says that Congress has the power to regulate, quote, commerce among the several states. So if you just sort of very naively look at the text of the Constitution and ask, what does something have to meet, what does a federal law have to meet in order to be authorized by the Commerce Clause, it seems like it A, has to regulate commerce, and B, the commerce has to be interstate. And actually the individual mandate flunks on both counts. It's not commerce because it's actually regulates not having insurance, which is the decision not to purchase something in commerce, and it's also not interstate, even if there were a purchase of health insurance involved. Under current law, for most people, it's actually illegal to purchase health insurance across state lines.
We're talking about the healthcare reform bill. I think it's important to note that the healthcare industry, if you want to call it an industry, takes up roughly 17% of the national economy. I'd say almost 20%. So when we're talking about the reach of the Commerce Clause, if you say that Congress can't use the Commerce Clause to reach into the healthcare industry, you have to say that Congress doesn't have the power to reach into an industry that takes up 17% of our economy. I just don't think that's right.
Now, the government has also developed a narrower version of this argument, which on the surface seems more limited. I like to call it the healthcare is special argument. And they say, well, we don't want to say that all economic decisions necessarily are covered by Congress's power, but healthcare is special. Why? Because as Representative Richard said, everyone or almost everyone will use healthcare at some point in their life. So if you don't choose to pay for healthcare by buying insurance, that's just a decision to get healthcare some other way later.
The one count that is less well discussed and less well known is an issue of the Medicaid issue. The issue of the federal government getting the states involved in a Medicaid program, and then what I say is actually giving them a bait and switch, which means that they get us all reliant on a Medicaid program, and then they make the federal reimbursement for that Medicaid program in this new federal health care law necessarily reliant upon us increasing the pool of those eligible for Medicaid. In other words, a new federal health care law putting more people on the public health care doles, but doing it at the expense of the state taxpayers and not at the expense of the federal government that passed the law.
Wisconsin fares very differently under the Affordable Care Act with Medicaid than Florida does. And it's largely because Wisconsin has done a much better job of ensuring people and expanding coverage under Medicaid. For us, it's not a real question of hugely expanding our Medicaid rules. As a matter of fact, one of the questions that we're looking at with our committee is, since Wisconsin has a more generous standard for providing Medicaid benefits, what do we do for people in between the federal standard, the new federal standard, and the standard that we have now? Florida is in a very different position, where they're going to have to add millions of people to their Medicaid rolls, at least according to their laws, because their Medicaid eligibility is so skimpy compared to ours. So our interests with Florida are not aligned with Florida, and I don't think that if you're making an argument about the impact of states, that this is the place to make that argument.
I mean, I think panels like this are useful in that we can air the opposing perspectives on these important issues and hopefully get people better informed about them than they were before. This is an issue that's big enough that it's not just an issue for experts in the field, lawyers, doctors, or economists or whatnot. It's also an issue for other interested citizens and community.
Oh, I'm sorry.
I just want to add, in addition to what Representative Richard just said, that a lot of other countries do an awful lot of other things, but I'd still rather live here. And I'd rather live here because, in large part, we don't do many of those things. We preserve more of our individuals' freedoms and liberties here in the United States of America. We have more local control, which is something that federalism has granted us that virtually no other country has. That is exactly what I think makes our country great, and that's what we're fighting to preserve.
Talk about this, man. I love my country too. And I can't think of another place I'd like to live. I've had the opportunity to live in other countries, and I'm glad I'm here. And I think one of the strengths of our country is our strong economy, and I think it's important to note that the way they passed the federal health care law reflects how this country operates. There have been proposals to have the healthcare system modeled on other countries, and those have been rejected, both in Washington and here in Madison, because it's important to develop a healthcare system that responds to the unique features of our healthcare economy, and that's what this does.